welcome to the fifth episode of the USV series. Today, we will be deep diving into some aspects of cardiovascular health. Cardiovascular diseases have become a silent epidemic in India, accounting for a staggering 27% of deaths. In the past 3 years alone, we've witnessed a concerning rise in heart attack fatalities, with experts linking this trend to the lingering effects of COVID-19 pandemic. According to the National Crime Records Bureau, there's been a shocking 12.5% surge in heart attack cases in 2022, painting a grim picture of the state of cardiac health in our country. To help us understand, address, and manage this growing health concern, I have with me two of India's top cardiologists who will share their insights and strategies to raise awareness about heart health and overall cardiac wellness. So I'm delighted to welcome Professor Dr. Ashok Seth. He's the chairman of Fortis Escort Heart Institute at New Delhi, and he's the president of Asian Pacific Society of Interventional Cardiology. Welcome, Doctor.
Thank you.
We have with us Dr. Ashwin Mehta. He's an interventional cardiologist, Director of Cardiology at Jaslok Hospital and Research Center. He's a mentor in cardiology at the Reliance Hospital. It's wonderful to have you with us here, Doctor.
Pleasure.
All right. Dr. Say, to begin with you first, given the rising prevalence of heart disease in India, could you tell us a little bit about prevalent heart conditions and their primary causes?
Right. Yes, I think India is a capital of heart disease in a way, and the same goes for Southeast Asia. The commonest heart disease which is prevalent is coronary artery disease, which accounts for 80% of the heart disease. But then there are other important aspects as well. For example, strokes, which is a cardiovascular disease, peripheral arterial disease, which is also a cardiovascular disease. If we talk about other aspects of heart disease, rheumatic fever is still prevalent at 2% of our population. That's the cause of rheumatic fever is a streptococcus throat infection and immunological reaction thereafter. As far as coronary artery disease is concerned, we well recognize the causes, which is diet, smoking, obesity, hypertension, diabetes, all of which are highly prevalent in our country. Then there's another scenario of congenital heart diseases which exist in our country. There is certainly the cardiac arrhythmias, and then, of course, diseases affecting the heart muscle, which is cardiomyopathy. By far and clearly the strongest and the most killing of the disease processes is coronary artery disease. And we would say that India is the world capital for coronary artery disease, and 20% of the deaths of heart attacks across the world happen from a country, and therefore prevention of coronary artery disease constitutes automatically a prevention of heart disease in our country.
All right. And we'll talk about some of that prevention a little later on in this conversation. Dr. Mehta, building on what Dr. Seth has just told us, talk to us about some of the risk factor for heart disease in India.
Milone, I would divide into two parts. The correctable risk factors and non-correctable risk factors. To give you an example of non-correctable risk factors is, say, the family history. You are born. You're born and you inherit automatically the parental family history and you can't help it. The other one is aging process. You are bound to age. As the time goes by, each of one, everybody will have an aging process. And heart disease also should be considered as a wear and tear phenomenon, degeneration or aging process. But there are lots of correctable factors, and which I think is within the power, within the reach, within the control of an individual. Diabetes, yes, good control of diabetes. Hypertension, yes, good control of blood pressure and be aware of it. Smoking, totally avoidable, unacceptable. 3, 4, obesity. You eat to live, you don't live to eat. Keep it in mind. And as you increase your waistline, so you decrease your lifeline. Lack of exercise. Children today spend 2 hours a day in front of a fluorescent screen. whereas they should be spending time at the football ground. Sorry to say, but there are no football grounds in Bombay left behind now anymore. So that's and so on and so forth. Apart from that, the most important, probably to a large extent even unavoidable, is a stress. So these are the correctable risk factors. A good lifestyle can help to live you, if not very long, at least whatever you live, healthy life.
All right, all right. No, all good points, Doctor. Dr. Seth, building on what Dr. Mehta has just told us, what are the commonly overlooked symptoms or threats of cardiovascular diseases? And, what are the misconceptions about heart health that you think you could use this forum to clarify?
You know, I want to make everybody understand that some of the risk factors Dr. Mehta talked about go unnoticed. For example, high blood pressure. For example, diabetes. Uh, Stress is a relative term as to how it affects your own body. And of course, beyond that is still the pollution which is increasing in our country. And more recently, COVID, which affected heart disease. Diabetes and hypertension, however, can be picked up only by a regular examination. So I would say coronary artery disease is firstly picked up by knowing your risk factors. And secondly, 25% of coronary artery disease, which is blockages in the arteries of the heart, goes unnoticed and is asymptomatic, much more so in diabetics. So, if I was to say that the common symptoms of a heart disease, and let's now focus on coronary artery disease as the biggest killer in our country and in the Southeast Asia, then the typical pickup of a heart disease or a blockage is when you walk briskly, a chest discomfort or a pressure on the chest may occur on brisk walking, which would disappear gradually as one slows down. And this could be picked up even while climbing stairs briskly, going for a long walk, or in any urgent situation where a person has to suddenly do something fast. However, not all people get this. And that is why I say 25% of the coronary artery disease is asymptomatic. So, what we generally say is that if there is a risk factor in the family, which means a strong family history of coronary artery disease, which is one of the biggest risk factors, if a parent has had heart disease at a younger age, or has had sudden death at a younger age, or it has occurred in brothers and sisters, then it is imperative to start getting checkup and start knowing the risk factors. And I, if there's a family history, would start getting my risk factors, which also includes measurement of blood cholesterol, diabetes, check of diabetes and hypertension by the age of 20, so that I know my risk factors and I can modify them over a period of time. It's important to understand that prevention happens prior to developing symptoms. And therefore, it becomes important to know risk factors, prevent them, rather than await symptoms and then say, now I think I have a problem. Let me start doing some preventive measures. Preventive measures are for everyone who lives in this country. It could happen to me, it could happen to anyone at any time in life.
Dr.
I
Seth,
think, yeah, right. I think Ashok, as Ashok said, so many times people come to know that they have hypertension or diabetes when they go for insurance examination, and they get a shock and surprise both. My
yeah.
God, I never knew that I have hypertension, and that's when they come to know. So he's very right. I think it is better that we have a checkup, and I think we are very keen to send our car for repair or for servicing regularly without missing a date every 3 months. But what about our body?
Yeah.
We don't care.
Dr. Mehta, tell us, what is the right time? How does a person know that, okay, this is when I need to start?
Well, Miloni, in fact, when Vietnam War was there, the American soldiers between the age of, say, 25 and 30, and, it's compulsory if the soldier died, he has to undergo an autopsy or a post-mortem, and they found that aorta showed streaks of deposits of fat and cholesterol between 25 and 30. The first stage, just a streak. So that means the coronary disease, the block formation, the plaque formation probably is starting much earlier than what we think. So Ashok is right. I mean, to give you another example, when I was in Chicago, we were doing investigations of the school going boys and girls. 16% of the boys were overweight and their cholesterol level was more than 300, which I rarely see in India. So I do think that by and large, it is also we have to be a little pragmatic. You can't start checking children and school-going boys and girls and all. So I would say, on an average, if you have one or two known risk factors, then once in a year, full checkup between the age of 40 and 55 has to be done.
All right.
Has to be
Okay.
done.
Okay. Talk to us, Dr. Mehta, of how heart disease can be prevented and the role of diagnostic tests in identifying at-risk conditions.
Okay, that's a good question. First of all, we know very well that the certain blood test, the biochemistry, which involving kidney test, the liver test, the cholesterol metabolism tests, various aspects of the cholesterol lipid profile, and also I would say sugar, the diabetic profile. All those things have to be checked. We also feel that there are minor things which are very obvious. For example, BMI, basal metabolic index, and whatnot. Those are very obvious, but these things are to be checked completely. I would say, in addition to that, um, of late, I have started believing that since it's easy to do and it's very, very um, harmless, very readily acquired, and that is calcium score. Calcium score, to elaborate a little bit, is that kind of a CT investigation, computerized tomographic investigations of coronary arteries and chest that gives you a calcium deposits into the coronary arteries and the walls of the coronary arteries. And it is also proportionate. High calcium score will make me alert that I got to watch this gentleman a little more frequently. Stress test, non-invasive test. I think that gives you also a fair amount of information whether the patient may not be symptomatic, but some of them may be picked up. My God, he has an abnormal stress test, and he should go further in detail to get investigated so that we can do a lot to prevent the heart attack to come. Once the heart attack has come, the battle is to some extent lost. Our measure, our thrust is to prevent, keep people healthy. We will fail in that case. That's the problem.
All right. And both these tests, Doctor, the stress test and the test which determines calcium deposits. When would you recommend an individual do? You had suggested, I think, the age, the timeline of ages 40 to 50.
Different between males and females. By and large, during the childbearing period, that means between 12 and 50, the females have 8 times less number of heart attacks than the male. The ratio may change with the habits now. For example, more and more females have started smoking, and more and more females are working, so they have stress, and also the ratio may change. But by and large, it was thought that the hormonal benefits of a female hormone, especially between childbearing period 12 to 50, they get less. So now I think I would say a healthy man, apparently healthy man, should undergo checking, right, starting from the age of about 35 or even 40, 35 to 40, and so. And I agree with Ashok, if they have risk factors already present, like if they have a diabetes and smoker, then I probably watch them a little more closely, more like, Maloney, we had a study long ago. The study started, it's continuing still, called Framingham Risk Study. Framingham, it involved lots and lots of patients inside, and healthy men, I would not call them a patient, but healthy groups, we call them mild, moderate, and severe. If you have more than two risk factors, then your doctor should watch you and warn you more and more frequently. You might have to visit doctor even once in 6 months also. So this, I think, by and large, general outline that I told you, but it would vary depending on what your basic risk factor profile is.
We hear of these terms, right? Heart attack, cardiac arrest. Could you explain to us the difference between them and the implications of each of the term?
Yeah, I think that's a good question, Miloni. I think people do get confused about these two terms. The cardiac arrest is a complete stoppage or cessation of the heart's activity. The heart, it comes into a practically a standstill. That's a cardiac arrest. Common man says he died of heart attack. Sudden death, in a common man's language, is he had an attack and he dropped dead.
Hmm.
Heart attack in medical parlor, as we understand from the people, anyone who gets an acute myocardial infarction. But let me explain to you, there's a medical jargon. Acute myocardial infarction means when suddenly a part of the heart muscle, some area of the heart, stops getting any blood supply whatsoever due to a complete blockade of that artery, then that portion does not get any blood. If that does not get any blood, it does not survive. The initial period is injury, and injury, if it continues, then it eventually has irreversible loss of function, that means life. So that is the heart attack. Heart attack occurs, cardiac arrest is sequelae. The commonest cause of death in an acute heart attack is the cardiac arrest. So
Right,
these two are little different terms. I hope I made it clear.
right.
Heart attack means the process of that pathology, that part of the illness in which the patient has complete lack of blood supply to a certain area of heart, and that area starts undergoing injury, an injury followed by irreversible damage, and that's a heart attack. The stoppage of activity completely, which brain can't sustain for more than 3 or 4 minutes. And closer you are to the fourth minute, worse is your outcome. That is the cardiac arrest.
All right. Okay. No, doctor, you've made it very clear. Dr. Shade, to you next. Could you outline the significance of CPR, particularly in context for the Indian population?
Yes, Meloni. And just before that, I wanted to make another emphasis that women are as prone to heart disease as men. Uh, Wanted to say that we're not just talking about men.
Hmm.
Heart attacks and heart disease or cardiovascular disease is the biggest killer in women, 6 times more than any of the cancers that women actually have. So it's a very important messaging that we're talking about every bit, every age and every population and every sex, not just either for man or woman. This
Oh,
messaging is for all.
okay.
Uh, the second aspect, as you raised, is what happens when a cardiac arrest occurs. And Dr. Mehta clearly pointed out cardiac arrest is a cessation of the heart. The heart has stopped.
Hmm.
10% of the heart attacks, which means blockage of an artery of the heart, which causes chest pain, etc., 10% of those present as cardiac arrest. And therefore, some of the arrests that we see where suddenly someone who's standing collapses and falls
Yeah.
and dies is the cardiac arrest. Now, we must understand that we've seen these visuals more recently on social media
Hmm.
of young individuals or younger individuals or renowned individuals and celebrities suddenly were fine and then they complain of some discomfort and then they've collapsed.
Correct.
Sometimes I wish that some of those individuals actually collapsed and died, and you've seen those visuals, which are sometimes one feels very not very good about, is that they actually did happen. Those things happened in public places, gym, a hotel lobby, etc., where they could have been revived. And the
Right.
revival is simple. The revival is that every person in this country needs to know, or at least every person can institute resuscitation. And I didn't see any of those visuals where anybody rushed into institute resuscitation, and we call it basic CPR. What does basic CPR do? It's a simple methodology of keeping a person alive till a hospital comes. Just Dr. Mehta explained that when the heart stops, you only have a few minutes of survival because the brain gets damaged, there is no electrical activity of the heart, the kidneys, the whole body gets damaged within a few minutes. And if you only to keep the heart beating during that time till help arrive, it would be simpler. CPR, basic CPR involves that if a person collapses in front of you, you first make him lie down flat on the ground. After that, you, for the next 10 to 15 seconds, tap him, question him, is he okay? Is he conscious? Did he just pass out and faint? And if he hasn't responded, at the same time, while you call for help and get people around you to ring for ambulances and call for help, start massaging on the chest by putting your two hands right in the center of the sternum and compressing that by 2 inches for 100 beats per minute.
100
That
beats.
as 100 beats per minute. That pressure as you kneel and press the chest down in the middle of the sternum right here at 100 beats per minute can actually make the person survive for quite a few minutes till an ambulance and help arrives. This is called bystander resuscitation.
Right.
Every civilian should know it. Every citizen of this country should know it. Every patient's relative should know it because many of these, as you know, collapses happen at home in a heart
Correct.
patient who was known to have heart disease, and any of his relatives could have actually saved him. There are cities across the world like Seattle where every member of the community has actually been taught basic life support. Cardiac arrests, where living from cardiac arrest or survival from cardiac arrest happening in the community can only be 10%, has increased to 65 to 70% lives being saved from a cardiac arrest happening out in the community. So I'm emphasizing that bystander resuscitation, every individual knowing how to do CPR saves lives of those who would otherwise not survive, giving them a chance of 70% to live as opposed to less than a 10% chance of survival or invariable death. It is our responsibility as a citizen to know CPR. It's responsibility as a patient's relative to know CPR. And it is not just our responsibility to save our lives, it's our responsibility to save everyone's life, whoever collapses in front of us. That's what I would say.
All right. No, very important points, Doctor. And, I don't think you could have stressed the importance of CPR anymore. Talk to us
True.
about the effects and advantages of medication, in this context to treat heart disease.
Now, I think if I were to ask, can I prevent the heart attack by some kind of a medications or postpone if can't prevent? Yes. Postponement? Yes. So let me say the cheapest medication, which really costs nothing, that's the exercise. Easily available, anytime available. But people have, I do know that when I go and stroll around, I find a lot many people now in the gardens and the playgrounds, etc. Or morning walk, when I sometimes start my day early, I see a lot of people walking on these or jogging. Cheapest form of medication is exercise. Two, the diet. As I said, that we must keep on time and again making people aware of what is the right kind of a diet, and there are varieties of diet programs and all. Now, I don't think you have to be a stickler about the diet. Once in a while, if you invited friends and you have made some, I think you've broken the rule. I think exception confirms the rule, so you can have a little pleasure of the life once in a while here. But I have known of people who has a terrible diet, full of milk products and the non-vegetarian diet. By and large, incidentally, though, I'm not against non-vegetarian food, but basically and anthropologically, if you read Desmond Morris, the man who wrote beautiful books on human zoo, and I think we being derived from the monkey, by and large, we ought to be vegetarian. And sophistication in diet should be also important. I think the fast food which is spreading very fast, and then we got the syndrome called potato couch syndrome. The young boy keeps on munching potatoes and whatnot and hamburgers and watching TV and then putting on weight and also accumulating cholesterol in his body knowingly or unknowingly, so on and so forth. Now it's compared to a pill. Yes, I do believe that since 15% of the cholesterol only comes from the diet, only 15% of the blood level of cholesterol is constituted by diet. Surely 15% is important, and therefore you should be disciplined about your diet, all right. But even then, if your cholesterol, LDL cholesterol, which is really a brick which builds the blocks, if that is the high, I would certainly consider there should be no hesitation in consuming statins, the tablets which lower the cholesterol, keeps it
Right.
low, and I think that makes a remarkable difference. Believe me, Miloni.
All right. Thank you very much, Doctor, for your inputs on that. Doctor, say to you now, could you discuss the benefits and potential risks associated with, say, invasive procedures and maybe minimally invasive procedures like angioplasty?
Yes, we would. I think it's a very important question. Just one point which I missed out on CPR. Many listeners or viewers would be wondering, how do they learn CPR or how do we grasp CPR? Uh, I would suggest that while numerous courses are being done by various bodies, including our cardiological societies, around teaching the community CPR. Hospitals are doing that, societies are doing that, but it's also very easy to grasp basic CPR for the benefit of your family and the benefit of everyone. Is just there are numerous YouTube videos which are only 3 and 4 minutes, which describe and illustrate CPR extremely well. And I would want everyone to at least once after this view a CPR video, because it could help your family, your friends, or somebody in the community at some stage. Coming to the specific question you asked about angioplasty or the various treatment options, when the blockages get very bad, when they get to a dangerous level, when they create a heart attack, when they start creating such serious chest pains that it could be impending heart attack, when it spoils ability to enjoy life, or you become so symptomatic that you can't walk with those discomforts, and in life threatening situations, angioplasty and bypass surgery are two important treatment options. Over the years, both have grown in terms of their safety and in terms of the efficacy. And the discussion is no more revolving around whether angioplasty is better or bypass surgery is better. Over the last 20, 25 years, science, research, trials have evolved into outlining patients how one can benefit from either of those technologies. The
Right.
advantage of angioplasty, of course, and it's grown tremendously from 30 years ago to this date, is medicated stents, better medicated stents, more safer medicated stents, more effective medicated stents, and the treatment options have also become so safe and effective that we are improving day by day. Every 5 years, we are improving in terms of science and technology. The majority of the advancements, at least in angioplasty, have happened over the last 30 years to the last 15 years. And the 15 years have made a lot of difference. So I would say the advantages of angioplasty are that it is a minimally invasive procedure. It's done in a cath lab. There is no opening of the chest. It can be done through the groin or the wrist artery. People can walk out after opening up a blocked artery and putting stents in soon after the procedure. Hospital discharge is within a day. Blockages are treated effectively and safely with much lesser risk than major operations or bypass surgery. And also, on the other hand, return to activity, which is another important aspect of life, is how fast can you get back to your work? How less time can you take off from work? And return to activity, normal activity, is within 24 hours to 48 hours. And return back to work can be between 5 to 7 days. In fact, people can actually run after 7 days. We must remember that we're not saying X is better than Y. There are advantages of bypass surgery, which have been
Sure.
well demonstrated in many
Yeah.
patients. It is a very effective and robust treatment for a lot of patients. We are absolutely in favor of people having bypass surgery also for the right conditions and moving ahead. It's robust, it's long lasting, it's durable. In diabetics, it works very well. For people with bad hearts, it works very well. But there are always going to be patients where we actually balance out risk, effectiveness, benefits,
Correct.
and it changes from individual to individual.
Following, say, treatments or procedures like either angioplasty or bypass surgery,
Yeah.
talk to us about the importance of cardiac rehabilitation. Some points already have been made by Dr. Seth, but if you could delve a little deeper into it.
Oh, I like think that it is comparatively cardiac rehabilitation is a new science, all right, and also um, underutilized. Its importance has not been so well realized. So I think most of the doctors who offer the treatment in form of a procedure or a prescription, and that they are left on their own. I feel the cardiac rehabilitation has a very, very important role. I've seen some patients who were barely able to walk with the pumping power of the heart reduced to about, say, 15%, 20%, and their heart is being made fuel efficient again because the heart is reconditioned. When you send a patient to a rehabilitation program, he undergoes graduated, well-defined exercise program in which they are being constantly monitored. And like for to give you a simple example, Miloni, a 20-year-old boy is down with the typhoid or an enteric fever. 3 weeks later, when he climbs 2 flights of staircases, his pulse rate would go to 160. But the same boy on the 10th day would hardly go, the pulse rate would be 80. So this conditioning is extremely important.
Okay, doctor. These are now my last questions to the two of you, and starting with you, Dr. Said. Considering the mortality and the alarming numbers, that you and both Dr. Mehta have pointed out, uh, and could you talk to us a little bit about dietary modifications that you'd advise for promoting heart health? I think Dr. Mehta underlined a few. One of them being junk food.
Yeah.
But talk to us a little bit about that and how
Yeah.
would you say these could be sustained?
So the dietary modifications, we must understand that coronary artery disease, heart disease, is not a disease just of the rich. In fact, heart disease across the world occurs in countries with all forms of socioeconomic strata and also occurs with the same intensity in lower socioeconomic strata in our country. So it's not just to do with rich and heavy foods. We must remember that in terms of what we eat, it's always
Right.
been shown that vegetables and fruits are the best form for our own health. Low salt diet decreases hypertension. So low salt, high in fruits and vegetables is an important form of our diet. Unfortunately, our lower socioeconomic strata can't afford that so readily. And that's one of the reasons why we feel that there's also an increasing heart disease in addition to the salt that everyone eats in plenty in our own country. You know the very fact that our food relies on salt to the extent that agar sham ko in the evening, if you don't have samosas with tea, we say, oh, where is it gone? Or pakoras, all those the lots of fried food and snacks that we eat, be it even bhujiyas and everything that we actually have. So that's one aspect of diet. The other important aspect of diet is the bad oil. It's not the fat, it's not the fried food, but it's what it is fried in. We call it trans fats.
Right.
Recooked oil, which is another way which our population lives, because many of the every socioeconomic strata don't necessarily throw away the oil. But we've
Correct.
learned to now throw away oil and not keep on recooking food in the same oil. Outside, as we eat outside, every food is cooked and recooked in the same oils. And that's what we call about eating outside versus eating at home. It is the trans fats which are heavy, which actually are the worst things for our own heart. And it's the trans fats we have to remove from our own diet. As far as most fried foods are concerned, and Dr. Mehta emphasized that occasionally everything is okay. But healthy diet consists of what you eat regularly every day. Occasional parathas, occasional samosas, occasional even fried food of any sort is fine when you indulge yourself. What is very important in our own unfortunate communities is that when we become sick, when we fall ill, when we have a heart attack, when we are diagnosed to have heart disease, when we are diagnosed to have hypertension, we start instituting these measures. And a patient who's had heart attack suddenly at home has his food cooked totally differently and separately, totally devoid of any oils, totally devoid of any fats, while the rest of the family continues to eat the
Continue.
oily fried
Done.
food.
Yeah.
And actually, a healthy diet is neither. The healthy diet is neither devoid of total fats and oils, and the healthy diet is not totally fatty and oily. It's actually the healthy diet which is common for all population. I sitting here don't know whether I'll have a heart attack tomorrow. It is as it doesn't even give a warning to many of our patients who we see
Yes.
every day and we treat every day, and we surprise ourselves. Having worked in this field for 40, 50 years, we're still surprised to see how suddenly it can affect anybody who didn't have any symptoms. I say it's in our not in our hands, it's in our feet. 200 minutes of walking per week. What does that translate into? 40 minutes of walking 5 times a week
Right.
decreases our heart attack rates by 25%. That's more than any medication can actually do. It takes away stress, it decreases our weight, it brings us to the normal body weight, it decreases our cholesterol levels, it controls our diabetes, it controls our hypertension, it controls our blood pressure, and it gives us a self of well being, and it takes away our stress.
The prevention is in your hand and discipline is in your hand. It is, if it is not important, perhaps maybe longevity might not always be controlled and might not be in your hands, but certainly whatever you live, you will live healthy, full life. You will live full life provided you practice the principles of healthy living.
In India, cardiovascular diseases pose a significant health challenge outlined both by you, Dr. Mehta, and by you, Dr. Seth. So, thank you very much for your insights. And, as you've pointed out, contrary to misconception, cardiovascular diseases affect all socioeconomic groups, and it's a leading cause of death among women, surpassing mortality rates from breast and other cancers combined. And this really highlights the pressing need to address cardiovascular disease as a public health priority, considering its impact on all segments of our society. So, thank you very much, doctors, for the information that you have provided to us today, which we're sure will benefit everyone watching. To all of our viewers, you can catch all the episodes of our interviews with top medical experts on diabetes and heart health on our website, economictimes.com. Thank you so very much for watching.
Thank you. Thank you very much, Melanie. It was a pleasure speaking to
Thank you.
you.
It was my pleasure to have you here with us. Thank you.